very important aspect which we cannot ignore. Today, we are going to discuss how hormonal imbalance can impact our menstrual health. Myself, Arpita Dev from Saathi, is going to take this conversation ahead. Today, I have Dr. Pooja Gupta from Nadi Arogyam, who practices homeopathy as well as she is a Pcos educator. Dr. Pooja, a very warm welcome to this session. Thank you so much for
Thank
joining us
you.
today. And we are very excited to learn more about how hormonal imbalance are and how it impacts menstrual health. So before we start with today's session, would you like to share a few words?
Yeah. So, hello everyone. I'm Dr. Pooja Gupta. I am basically a homeopath. I'm a third generation homeopath in my family. Along with that, I'm also a PCS educator and a PGDM postgraduate in dietetics and nutrition. So, these are my few qualifications. At the same time, I've done fellowship courses also. So, when I started practicing around 8, 9 years back, now as I genuinely don't have an exact count ki how many years have passed by now because I have belonged to a family of doctors, so it has been into us that we kind of just do it, right? So when I started practicing, it just all went pretty well, and everything was fine and all. But then I started seeing that a lot of females were coming with their hormonal issues. Okay, either some small issues like leukoria, maybe they miss their periods or acne. Then it became an important part that if a female is suffering with any condition, hormones and the health related to hormones is also important. It is of somewhere, or it draws my attention. It actually drew my attention that you need to start focusing on these topics also. So that's how the whole evolution has happened so far.
Okay, so that's a great beginning, actually, Dr. Pooja. So to start with that, like nowadays we listen a lot about hormonal imbalance. It's a
Yes.
very big discussion of like debate. So could you please
Hmm.
tell us why it is so important for women, especially?
Yeah, so it's not just women, Arpita. It's basically common to both the genders when we come to it. Why in female? Because every month, every 28-day cycle, 30 cycle, 32-day cycle, women go through a drastic change in the, in the quantity and the volume of certain hormones in their body naturally. That's pretty normal for them. But what happens is that these fluctuations are okay till you don't hamper them with a lot of factors, lot of triggering factors, which I would like to talk about in later in this talk. If you don't hamper them, they're going perfectly fine. You get your periods on time, you have amazing skin, there is no acne around it, you are able to lose weight, you are able to basically maintain a weight. It's not about losing or gaining weight or something like that. It's about maintaining a proper weight, right? So that is okay, right? And these hormones are in such a delicate proportion in our body, like they are in a range like 2 to 4. TSH, for example, let's take an example of simplest of the hormone, that is thyroid. Everyone knows about thyroid hormone, right? So one of the thyroid hormone is TSH. उसका कभी ये नहीं बोला जाता, no one says कि it's 4 or it's 5. That is the perfect. No, we always talk about it in range. So 2 to 5 is okay. You see, so something below 2 is not okay. अगर आपका thyroid का level is below 2, it's not okay. और अगर आपका thyroid का level is above 5,
Hello. Hello. Hello? I think there is some technical error. Okay, I think there is some technical error from Dr. Pooja's end. So we will wait for her to rejoin. She would be rejoining us soon. Thank you for the patience.
Hello.
Dr. Pooja is there.
Yeah,
Hi.
I'm there. I'm there.
Yeah.
What just happened?
I think there was some power cut from your end. Was we don't know. We
No.
can't hear you actually. Suddenly
Oh, I'm
there was
really
no.
sorry. Okay, so let's get
Never
back
mind.
to the question
Yeah.
again.
Let's
So the
continue.
question was basically why hormonal health is so important for women. Yes, so for women, there is a fluctuation in the hormones throughout the month. 1 month itself is a major event. For a male, the event is around 6 months fluctuation or a 7th month fluctuation. That's why hormonal health is so important in the case of female. Now, when we come to female, our hormones actually are decided by our mood also. So that is the key point. Why our mood or our emotions are, affecting the whole hormonal health and everything. So this brings the whole question back to us that hormonal health in female is so important, but at the same time, it's the most ignored fact also.
Yeah. So what I understood that emotional health is equally important as well as responsible for this balance of an hormone in
Yes,
case of women.
yes,
Okay.
yes, yes.
So if I can wrap up with the second question, like you said, the
Yeah,
hormonal imbalance is not only for one particular community. So my question, direct question would be, who can have this hormonal imbalance? Like
right.
men, women, kids, anybody, or is there any particular community who can have this hormonal imbalance?
No, so it doesn't depends on the community. Anyone can have a hormonal imbalance. I told na it's a very delicate thing. अभी आपको you have to maintain it from 2 to 5. अभी there is a range fixed. You have to do it from 2 to 5. Now such a delicate range when you have to maintain it, slight emotional disturbance, slight changes in your health, slight changes in your environment can actually start bothering your hormonal health. Now, let's take it for an example. What are hormones? Let's first understand that. Hormones are simple messengers. If there is a hormone that is released from your pituitary, which is somewhere in your brain, so don't get too much confused by it, and it has to give a message to thyroid gland कि तुम्हें you have to work it this way today. Now, this message has to be conveyed to your thyroid. How this message comes to your thyroid is through the hormones. So the hormones are basically the messages. Nowadays, we send text message that deliver me this, deliver me that. Can we do this? Can we not do this? So it is a simple messenger system which gets disturbed. Now, for example, so my pituitary want to basically convey to my thyroid that you have to do a particular function today. But instead of doing that, it says that don't do this particular. Now, this is the imbalance. Or you start performing extra, you start performing over. So these are the hormonal imbalances that keeps on happening. Now,
Okay.
hormone imbalance is one thing that keeps on happening in morning till evening also. In one day itself, you have a lot of hormonal changes. So you must have heard we basically prescribe that if you want to get any test done for your hormones, you get it done in the early morning. Why? Because the early morning values of thyroid and the late night evening values of thyroid are going to be varied. If your morning values of TSH is 2, Probably the same day your evening value can be 5. Now, this can bring you to a panic state. I have a problem. Baba, I am not fine. My thyroid is not okay. But that's not right. By this time, you have done so much in your day that hormone is going to be imbalanced. And that's natural. So that's why we it in the morning, early morning. So, hormonal imbalance doesn't decide you are belonging to a particular community, what is your age, what is not your age. Yes, definitely the pubertal age, when you start your reproductive age, till the end of the reproductive age, the hormones are on the maximum, right? But hormonal imbalance does happen in a child as soon as they are born, and it is also there in people just before they die. You know insulin, you know diabetes. Diabetes is also hormonal imbalance. So it
Hormone
is there,
imbalance.
right? So
Right.
that is the thing. It doesn't decide मुझे आज इसको affect करना है, उसको नहीं करना है.
Okay, so we know a lot about diabetes and thyroid because it has become very common. Now it is not only
Right.
happening to middle-aged people, even the young peoples are having it. So coming directly to the menstrual health, which is our topic, which is our focus. So if you want to tell people about then what are the common signs and symptoms people should be alert of, that yes, this is a kind of hormonal imbalance and now I should go to the doctor for the checkup. So can you
Yes,
please
yes,
tell us
yes.
some common signs and symptoms?
Yeah. So primary signs in the case of women, when you are like, on that starting stage of a hormone being imbalanced, is that you start having mood swings. People start calling you crazy. You start overreacting of things, or you become panicked. Yeah, I can't do this, or you are like, you have done that thing a lot of times and still you are in that state. I can't do this, or you start having those sweaty arms all of a sudden. So this is the primary sign that our body gives us. But most of the times and most of the cases we ignore it. We say, probably I'm not reacting fine, probably I am not being well, probably people are saying, right, I am only overreacting. But sometimes you overreact, and after a minute you think over it, you're like, yes, I did overreacted over it. Yes. So that is mood swing. You don't know when you want to be sad, you don't know when you want to be happy. So the first sign of any hormonal imbalance is a mood swing. Second, in case of female, is your periods. Your periods are like your red line symptoms. If you have a cycle for a very long period of time, which is ranging from 28 to 30 or 32 days, for example, but your periods start coming before 15 days, money, you just now ended up your periods, and within 15 days, you have another period. Or your period is delayed for more than 42 days, that is second red line symptom that you have, or you might start, or you might end up into hormonal imbalance. Third is your leukoria, vaginal discharge. Okay, so that is one thing girls don't want to talk about, but that is a proper health indicator in the case of females. If your digestion is not proper, you will have your leukoria. If your vaginal health is not proper, you will have your leukoria. And leukoria, if it is, just before your periods, that is normal. If you have leukoria in the mid cycle of your periods, for example, you have a cycle of 28 days. तो उसके बीच में if 14 15 then you have a little bit of white discharge, that's also normal. But if you have white discharge, anal discharge, which is changing its color, either red, pink, yellow, green, brown. These colors are not okay. Totally not okay. If they start smelling anything like a cheesy smell,
Pungent
onion-like
smell.
smell,
Yeah.
pungent smell, it's not okay. If the white discharge or the vaginal discharge is giving you symptoms like itching and burning in that area, it's not okay. So the third one is your leukoria. Fourth one is your acne, or the cosmetic health. So you should start having acne on your face. Specifically, understand that girls do have acne before their periods, and it is normal to have it. Say, I have it right now also, one, because I am about to approach one. So that's pretty much okay. I am not bothered about it. But if you have your acne, apart from that, it is bothering. If you have your acne which are big in size and have pus, white or yellow or green color, it is bothering. And if your acne starts leaving a mark, dhabba, that's
Hmm.
also not okay.
Spot.
So that starts, yeah. So you shouldn't have those marks left on your face. Next is you start having hair growth on the unwanted parts. So basically you start projecting something like what is a male beard or a male mustache. So you become somewhat like a mannish in your appearance. You start having a upper lips growth. Chin, oh my god, this area, girls usually come to me with this area full of hair, and it is really bothering. This sideburn is full of hair, so this is called hirsutism, or excess or unwanted hair growth. Hair fall, not just any hair fall which depletes your hair from this area. Can you see this area starts depleting? So these are basically the signs. If you have any two signs also out of all the five signs which I have told you, then you might, or you already have, or you're about to have a hormone in your body.
Okay, so the signs or symptoms which you have mentioned is clearly indicative. Any girl can clearly identify these symptoms, and they might
Yes,
understand that this is the right time to visit a doctor.
yes,
So,
yes.
to my viewers, I would request this is the correct time. If you have any questions, please drop down in this chat box. We are definitely going to answer these questions. So, doctor, my next question is, hello.
Yeah,
Yeah, can you?
yeah, I can hear you. Yes.
Okay, so doctor, my next question is how hormonal imbalance can impact a woman's menstrual cycle.
Oh, yes. Okay, so that's exactly a girl need to understand. Your hormonal health and your menstrual health is pretty much connected. But first of all, you need to understand what is a normal menses. Periods are normal when? When you can say my periods are normal. Okay. So periods are normal if your cycle of period, money, your repetition of your period. So your period ended on day one. So your cycle next period should come within 28 to 32 days. Either it has to come in the next 28 days, 29 days, 30 days, 31 days, or 32 days. This is normal. And the period should last for not more than 4 to 5 days. Okay? Now, this is
Okay.
normal. And you should not have any pain in your stomach. First day, 1 or 2 hour pain is also okay. But beyond that, you shouldn't have, and you are able to continue your regular day to day activity also. That's a common sign that your menses are pretty much okay. Now,
Okay.
what is hormonal imbalance ke menses? So your menses can come prior, like 15 days. Within 15 days, you have second period. That's not good. After 42 days, if you have your periods, that's also not good. If your periods are pretty small, they are only for 1 or 2 days, or some girls only have it for hours together, like 6 to 7 hours, that's not okay. If you have your periods, extended for more than a week, after 7 days, also you have your, blood is coming, bleeding is happening, it's not okay. So these are the signs which say that it's not okay. And yes, dysmenorrhea, the pain during periods, is not okay if it is beyond 6 to 7 hours. And if you're not able to continue your day to day activities also. So you need to be pretty much understanding about these things, and they're not okay when all this is happening. And if your periods are irregular, for example, this time they came in 30 days, next time they came in 42 days, next time they came in 50 days, and then all of a sudden they came in 15 days or 20 days itself, so that's not also okay.
Okay.
Yeah,
So, what are I'm sure there are many different types of like hormonal disorders. So, can you please tell us few which is very commonly seen in the urban women and the girls? Even the young
yeah,
girls are having this kind of disorders, but they are not aware of it.
yeah,
One
true.
is like
So
Pcos. Yeah.
yes, 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 yes. So Pcos is the major one nowadays. But before that happen, the one thing that happens in our body is that excess production, or the imbalance because of the excess production of testosterone. That is the male hormone. So that is the first thing that starts happening. Most commonly, it is there. Second is PCOS, that is PCOD, PCOS, polycystic ovarian syndrome or disease. Either of them. Just there are two terms. Don't confuse by them. They are the same ones only.
Okay.
Next is thyroid. Thyroid disorders. I have patients ranging from age of 11, 12 till the age of 70 also. And when it comes to PCOD, I have patients ranging from as young as 10 years old girls to girls who are 40, 42. So there is no range nowadays because the girls are hitting their puberty also early. So all these
Very
hormonal
early.
changes are coming in their, yeah, yeah. So this is called precocious puberty. When you see it in medical term, the word we give it to the precocious puberty. Puberty much before in time. Like होना चाहिए, it should be around 12 to 13 years of age. But if anyone is hitting their puberty before that, we start calling it precocious puberty. So all sorts of these kind of hormonal imbalance do happen. Now, apart from that, there is diabetes, which is adding up in young girls. There is insulin resistance. It is not a proper diabetes. We call it as pre-diabetes or insulin resistance only, right? So these are the most common hormonal imbalances that we see nowadays in girls who have started menstruating or who have started their reproductive life.
Okay. Okay. So, are there like ways where we can prevent it? Like, or
Yes,
else, like, if PCOS is happen, somebody has PCOS, then they have to with it for the entire life, or it can be prevented actually from at the early health.
yeah, yes, it can be prevented. Yes. First important thing is be aware about it. All the mothers out there who have young daughters, all the girls out there who have younger sisters, or any girl who is listening to me right now and feel like that you can relate to any of the symptoms which I'm telling to you right now, please be conscious about them. Please be aware about them. If you get it treated, if you get it reversed, if you get it sorted at the earliest, this is the best way. Now you ask me the question how this can be prevented. Yes, this can be prevented very, very easily. Your emotional mental health is something which is
Yeah.
going to hamper your hormones the most, right? So start taking care of that mental emotional health
Yeah.
as early as possible, and try to track down the points and try to track down the situations in your life where you feel like I am being trapped. Abhi, I cannot be in the best of my emotional health. For example, बहुत sorted से example I'll give you. If you are working somewhere and you feel like, my workspace is not giving me that motivation, my workspace is not giving me that zeal to do work, or my workplace, my colleagues are not motivating me enough. They're putting me down all the time and not being happy about it. Take a quick decision about it. Either you talk to them, confess them, and try to solve the situation. If that doesn't work out, switch over. You don't have to end up in every problems like this just because you have to continue doing it. This way, you're going to only hamper your emotional health. This was a very small example. I have so many PCOS cases, so many kids nowadays, girls who come to me, and we find that their root cause or their emotional cause was basically stress for
Stress.
studies,
Stress.
right? And it is not, in most of the cases, if I talk to their parents, if I talk to their siblings, they say, we have not told them to study so much. We have not asked them that you have to perform best. This is a self imposed test. I have to top. I have to crack this competition, I have to be first in my school. What people will think about me and all that. So, these kind of stresses, if you start tackling them when they come in your life, or if you have you so I'll tell you one thing. When you are going through stress, it's very difficult for you to understand that I'm going through stress. It is the people around you, it's your family, your friends, your peers who will understand the first go, iska behavior has changed, this particular person is not behaving the way they used to behave before, and you track the stress over there and you counter that. So my workspace. I have a clinic. I own a clinic, and we have more than 8 to 9 females in our clinic. We regularly talk to each other. So if I see a female came to me, one of my co-worker came to me today. So these are working under me. They are my juniors. So one of them has come to me and they're not in great mood. We don't neglect. We don't postpone that issue. We try and talk to them then and there. What is the issue which is bothering you? And once you talk to them, energy is automatically flown. They feel so relieved and they're in the best mood. They can give their maximum. So this is how you need to be. And that's what I say when people say, na, women empowerment.
Correct.
No, no one else can bring women empowerment. You have to do it on your own.
Unless
It is how
you do
you
it from
make.
inside for
Yes.
yourself.
Yes, for
Yeah.
yourself and the people and the ladies around you and the women around you. Talk to them. Don't linger it on. Chodo hoga iska koi issue. She must have fought with someone in the home. Why should I bother about it? Something might be wrong in their family. No, no, don't do that. Talk to them. If you know that person, talk to them. So emotional health, if it is fine, then your hormones, your enzymes, your whole body, your physical body is going to be in the best of its shapes. I mean, nothing else can bother you then.
So basically, it's like address the concerns, the issues, sort it out, and try to maintain the emotional balance, to maintain hormonal balance. That's the
Yes.
miracle thing. Okay, so that
Yeah.
is about the prevention. And if someone is suffering already from PCOS symptoms, so is there
Yeah.
any
Yeah.
test available which we can take
Yes.
and get into and understand? And when is the right time to go for that test?
Yes, yes, yes. So there are number of tests available. If you believe that, you have heard people saying that these are the symptoms, or today someone is listening to our live and they understand probably I might have it. So what you do, either you wait for your next cycle to come. If your next cycle doesn't come in next 10 to 15 days, then you go for the second option. If your next cycle comes in next 10 to 15 days, wait for it, let it be over. Once the period are over, the next 5 days, 3 to 5 days after the periods have ended, are the golden period to get all your hormonal tests done. Be it a testosterone test done, be it a insulin level test done, LHS to FHS ratio, DHES ratio, or anything, and even your ultrasound. Your ultrasound of your abdomen
Okay.
is also supposed to be done after your periods are over. That is the golden time. But since we all know most of the cases of PCOS don't have their periods for months and months and years together also. So they can't wait for their next cycle. That's what I'm saying. If you're hearing it today, that you might have it, or if you feel like you have it, wait for 10-15 days more. If you still don't have it, then go for these tests and you might see something is there. I trust, I believe, I pray that no one should have it. But if you have it, then address it out. So, because I tell you, I have been practicing homeopathy, PCS education from last now very diligently from last 4 years. COVID has taught me a lot about all these things. And we have seen in our clinic, in our surroundings, that PCOS does get reversed. Your all symptoms are gone. Your obesity, if you're fat type of PCOS, if you're lean, you come back to your original, body weight. So we have seen things changing like this, and it does work. So it's better you address, you understand, get yourself tested, and as soon as possible start yourself on medications and a proper counseling also.
Yeah, because first thing is like tracking your periods. Once you track your periods, then you
Yeah.
will get to know when it's supposed to be tested. And I think
Yes.
I'm just wrapping it for our viewers so that understand exactly what we're trying to say here. Secondly, counseling so that the issues causing this PCOS get addressed at the before end, and the
Hmm.
relapse of PCOS doesn't happen. Right.
Yes. Yes. Yes.
Okay. So here we comes to the last section of our call today. What are the treatments available to address PCOS?
Yes.
First,
So
I
there
would
are variety. Yeah.
discuss about the
Please. Sorry.
hormone therapy.
Hmm.
Can you please tell us about the hormone therapy?
Yes. 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 Okay. So, with any hormonal imbalance, there are basically two sets of treatment available. One is HRT, that is hormone replacement therapy, and the second is surgery. If the organ itself is not functioning well, which has been affected, which is supposed to produce that particular hormone, then you get it surgically removed or corrected or drilled. So this is one way. When we come to HRT, so now HRT, so first of all, I would like to address one more thing. HRT was being, discovered as an emergency procedure, as an emergency medicine. When you don't have your periods, just take it and you are done with it. Don't take HRT. Even any gynecologist, any allopathic doctor would recommend that. When I was doing my PCS education also, they would say that don't take HRT for more than 30 to 40 days without getting your test done. And if you don't have any results after that, then just stop it, because it is just a supplement therapy. It is a supplement therapy. For example, your body is not able to produce estrogen, which is a female hormone, in the right quantity. You supplement it from outside. Similar to the fact that, nowadays people say my vitamin D is low. So what do? You take those four tablets once and you supplement it. But do you take it for the year together? No. You then go and get your test done and you try to eat food which is high in vitamin D. Same as for the HRT. It's hormone replacement therapy. It's a supplementary therapy. You are not supposed
Okay.
to take it for more than 30 to 40 days. That's where, homeopathy and the natural holistic health treatments come into the impact. Once you have tried that HRT and it's not working, or it has hampered or anything like that, then do try this, because this is the way where you can reverse it back. You can bring it back to normal. You can actually cure your PCOS. You can cure your symptoms and everything. And girls out there, please, please, please try not to opt for surgeries for your PCOS until unless you have a chocolate cyst, which is a hemorrhagic cyst. Until unless you don't have it, please don't opt for it, because once you go for it, it is not going to be reversed after that. So try to be more compassionate for yourself, more patient for yourself. That I'll wait for the right thing to happen and then opt for something like that.
Yeah, I think that's when the lifestyle change comes into the picture,
Yes,
because that is
yes,
the one thing which every people can do it. Only they needs to feel motivated to do it, because
yes,
it's
yes,
very
yes.
easy to say, but
Yeah,
one person has to motivate herself. Okay, I need to do that. So
yeah,
please, doctor, give us some tips for our young girls over here. What lifestyle change they can do?
yeah. Okay, so when it comes to lifestyle change, when I started doing that and I started suggesting girls, so most of the time, what it used to happen, I've told them, for example, I've given them five instructions. They would follow it for 1 or 2 days max, and that I'm saying you genuinely max. On the third day, they'll be like, leave it. I just can't do this. How it is even possible? Because you have this problem because your lifestyle is hampered, and in day one or day two it cannot be reversed. So there has to be slow changes in your lifestyle. First of all, be very, very patient to yourself. It has to be baby steps. For example, let's take water quantity. So if you're taking around 3 glasses a day, start it with slow. Take it to 4 glasses a day, then 5 glasses a day. Don't decide that today only you have to drink 1 gallon. That is 12 to 14 glasses a day. No, you can't do that. You just can't do that. So be very patient. Any lifestyle change, you already know it. Something which is going wrong, you already know it. As a doctor, I genuinely know most of my patients who come to me, they know what are the problems they are already doing. But don't make very drastic changes. For example, if you have been sitting on your couch and doing work from home for a very long time, don't just decide in a day, I'm going to the gym. No, you can't. You just can't. Don't do that. Start with small, small steps. Start going for a walk for 15 minutes, then to 20 minutes, then to 30 minutes, and then slowly put yourself into a gym subscription and then go for the gymming. Similarly, when it comes to the food switches, stick to your staple food. If you're a Bengali, stick to your rice. If you're a North Indian, stick to your wheat. If you're a Keralite, stick to your fish. This is most important. Don't play around with your staple food. Your staple food, something which you have been taking for generations together, something which your family has been
That's true.
feeding, cannot be the wrong thing. Okay, so keep continuing that. Now, when you add a burger or a pasta or a pizza to it, Once in a while is also okay. Now, don't cut yourself out of the world all of a sudden. Continue doing that, but then you start doing small, small menial changes for that. Increase your water quantity. A girl should, around the age of 14 to 20, or even 30, should have a quantity of around 2 to 3 liters. Now, this is also very arbitrary term. It depends from person to person. We calculate how much of water quantity is needed. So that's why I say, at Nari Arogam, we basically do a customized diet plan. We do a customized lifestyle counseling where we first of all understand what is already going on in your life. If you're already on potatoes, we cannot stop your potatoes all of it together. We cater them, we taper them down. Ki chalo, if she was taking 4 potatoes a day, she'll come down to 2 potatoes a day. Or we switch it off, right? So, for example, if you're taking white sugar, swap it with a brown sugar one. Try if you like the taste. If not, then swap it with a good. If not, then swap it with some other tasting or stevia drops, for example. But make your body as, like, if you have a disturbed body now, you can't just change it in a day. Be very, very you know compassionate to yourself. Don't be very harsh on yourself ki day one I'll have to do this, I have to do this. That's why I genuinely don't tell people ki ye you have to do. No, you don't have to do ye. You first have to just do small small changes. So these small changes are going to make a lot of difference. For example, if you are taking a car for a 1 kilometer distance, if you have a shop around, don't take a car this time. Just walk. Put a nice song in your ears and just walk around. So that's another solution. Try opting these kind of solution, but be very, very patient about it.
Yeah. Yes. Dr. Pooja, thank you so much. I think the whole solution is that try to love yourself, be
Yes,
compassionate about yourself, and
yes,
that's the true empowerment. The meaning of empowerment it is. Nobody is going to change your life, unless you do it at your own self.
yes.
So that is the thing I want all my viewers to take away after this session. And yes, this is a very informative session. Dr. Pooja, thank you so much again, and we hope to see you more in coming futures with Saathi. Thank you so
Thank
much.
you. Thank you
Thank you.
so much. And one thing I wanted to talk about Sati pads is that, sorry, there was nothing we could talk about it during it, but, I
Yeah.
am genuinely surprised and I'm genuinely owing to this fact that you people are doing some amazing thing, getting those biodegradable sanitary solution out there. I recently saw that you've also developed a biodegradable apron. I mean, that's so good because as doctors, we do have to use them. And I was seeing that the trash was going again, the plastics, or if we were having even the fiber one, the fabric one, they were also not very healthy. So I just saw that some days back. And your small, small
Yeah.
initiative would make a big difference. And keep continuing doing that. I'm really, really
Thank you so
happy for
much.
whatever your people are doing. So it's amazing
Thank
to
you.
have an association with such kind of people. Thank you so much for having me.
Thank you so much. Thank you. Bye bye.
Okay, bye bye.